Did you know stem cells can help relieve knee, hip, or back pain?
In the lower back, that is really common right now. Actually, I think that the knee and the lower back is like really close. It's like we can give it to the patient a 70% of improvement under pain in one application.
Meet Dr. Irydia, an orthopedic surgeon using stem cell treatments in her practice. We sat down with her to see how this stem cell therapy really works.
Hello, my name is Irydia Pellegrini. I'm an orthopedic surgeon. I have 8 years of experience doing this, and also have another specialty in regenerative medicine, like 6 years from now. I make my specialty in Guadalajara, Mexico. Right now is the biggest hospital in Latin America. Now I'm part of Mexican Federation of Orthopedic Surgeons. Yeah, actually, I think like 80% of our patients are right patients from all the world. If the patients don't come specifically for an orthopedic cause, always when they are here, they start to say, okay, I have knee pain, I have like hip pain, or my back, the lower back is something that's really, really common. And actually, our results are really, really good, over 96% of satisfaction. I think that the most demanding right now are like lower back pain for any disc, for example, loss of the cartilage between the bones and spine, spinal cord injuries, knee arthritis, hip arthritis, tendon problems, muscle injuries. So we can treat all of that. Obviously, it's necessary to make always first evaluation, because the key for the success of every treatment is a good indication. So not all the patients are good candidates, but that's like all the things that we can treat in orthopedics. It depends a lot in what disease or what problem we are talking. For example, the most common part are the knee arthritis. In the knee arthritis, it's important that is like that remains some cartilage, because we need like a dye. The stem cells need like a dye to repair and regenerate the cartilage. So we need that there is some cartilage in the knee. It is really advanced. Then obviously still the knee replacement is the best option. For example, even if we have like a knee arthritis, but it's like some angular problems in the legs, well, I have to treat the cause, and the cause is more mechanical, not the degenerative, so the stem cells cannot work. Make the differentiation between a mechanical problem that is like more the angles and all of that, than a degenerative problem that is the thing that we can treat with stem cells. With the knee is a really easy application. It's a really quick application. Actually, we don't need like as much support, because the knee is really easy to get there. It depends on every knee, and it depends on every orthopedic surgeon have their own way to apply it. I like the lateral portal. I like to see the patient that is like the door to get into the knee. It's like a shot. Actually, the needle is like the same that when we put an intramuscular shot. Obviously, we make all the cleaning, like antiseptic thing and all of that. It's physical examination area. We don't need anything else. It's like a shot inside the knee in the lateral part, and it takes like 5 to 10 minutes. In the hip and in the lower back, we have to make in a procedure room, because joints are more inside, like more deep. And I need a fluoroscope or a C-arm that give me like X-ray in the real time, that I'm sure that I'm applying exactly what I needed. Obviously, I use a needle, a really thin needle, but really long. And I have like always, for example, in the hip or in the knee, I have to make sure that I'm in the joint with the fluoroscope, and once I get there, I have to aspirate and give some synovial liquid that it's sure for me that I'm in the right way. And for example, in the shoulder, it depends if it's for arthritis or from some rotator cuff tears. In that case, I need an ultrasound to guide me, because I have to apply directly in the injury. In all of the cases, it's really uncomfortable, but not really painful actually, because we use local anesthesia. Sometimes it's not necessary, but actually it's not really painful. But after that, the first days can cause like an inflammatory response, like transitory inflammatory response, that is completely normal. So you can feel inflammation or pain the first days, and we recommend some rest, 3-5 days. If you only want to feel like, oh, okay, I have like knee arthritis in both knees, we can do the application in 1 day because, like I said, it's really quick. And we recommended 24 hours here in the city just to keep in watch, make safe for all of that. And that's actually all the things that we need. Obviously, if you want to like, okay, I have the knee pain and the lower back and the shoulder and I have an IV infusion, well, we have to make like more days of application. But if like almost like every part we recommend it in 1 day, and it's completely. The most important thing for the patient is relief of pain. Always a relief of pain. It depends in what part, but for example, in the lower back, that is really common right now. Actually, I think that the knee and the lower back is like really close. It's like we can now give it to the patient a 70% of improvement on their pain in one application. So really, really good. Actually, that's for the lower back that is a little bit more difficult for the zones and all the things right there. But for example, for the knee and a good indication, I think that the patients can pass 3-5 years and still have no pain. The most quantity of doctors that can know and be educated in this, because it's a really good treatment that can avoid or can improve some results even after surgery or avoid some kind of surgeries. And of course, I really like to do surgery. It's my job. I'm a surgeon, so it's really good, but we have to take in the benefit for the patient. And I think that in the future, we can avoid some kind of surgeries like knee replacements, hip replacements, spine surgeries. Even if it's necessary, improve the benefits after the surgery with this kind of treatments. The benefit for the patient is the goals that all doctors have to pursue. I really think that this is the future of the medicine. This is something that we have to all know about this.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.